Hi, and welcome to Group C's Diversity Research presentation, exploring the effects of grief on Native American, African American, Latinx, and Asian communities. We have chosen to focus on grief. Grief is an emotion and process tied to loss and transition. We are focusing particularly on interpersonal grief and disenfranchised grief. Disenfranchised grief is particularly important when counseling culturally diverse clients. Values and beliefs may place pressure or restrictions on the grieving process and may discount events such as suicide, homicide, substance abuse disorders, job loss, and moving. Cultural beliefs and values can influence the grief process and response, creating a divisive path for some individuals. Native Americans usually hold a collectivistic perspective and view disruptions to the individual as breaking harmony within the tribe or community. Present is valued over the future. Interconnectedness between the mind, body, spirit, and nature holds significant value. Generosity is valued over possession, and extended family and mutual interdependence plays a role in the lives of Native Americans. Native Americans have suffered historical genocide, forced suppression of cultural practices and language, and general marginalization. Historical trauma can cause deeper feelings of isolation, depression, rejection, and disconnection from the present. This can cause disruptions in the tribe or extended family. Suicide, alcohol, and substance abuse can cause discord in collectivistic values. These are exacerbated by institutional exclusivity. Looking at interpersonal grief for Native Americans, we have a continuation of the journey rather than an endpoint on a linear path. This embraces the interconnectedness between mind, body, and spirit. Walk on replaces the term died. Rituals and ceremonies encourage spirit in the afterlife and provide guidance for channeling grief. Burials and spreading of ashes often take place on higher ground so that the body can be closer to higher being. To recognize and understand the connection between historical trauma, personal trauma, and presenting issue is one of the main desired outcomes when counseling Native Americans dealing with grief. It is important to view this from a strength-based perspective, as Native Americans place value on autonomy and respect. Looking at self-acceptance and self-permission to allow the grieving process to occur is another critical point when counseling Native Americans who are dealing with grief. When considering the cultural beliefs and values when dealing with the bereaved, it is important that the individual can explore their feelings of past traumas and experiences. In doing so, we want to focus on present-day paths for resolution and healing. Allowing the client to express their narrative and create new stories that allow them to identify strengths and envision change can help them through the grieving process. Identifying support resources specific to the client's needs and including community elders and spiritual healers when appropriate can also aid in the grief process. Offering alternative access to therapy and alternative approaches can also help heal in the grieving process. We have chosen to look at motivational interviewing, group therapy, and family therapy. These therapeutic approaches align with the cultural values and beliefs of Native Americans and allow for incorporation of traditional and alternative treatments and experiential exercises. Potential areas of resistance for Native Americans dealing with grief relate to transportation and childcare issues, insurance issues, potential wage loss, and these may decrease the consistent therapeutic engagement and attendance. Depending on their tribal affiliation and the effects of the individual's illness, issue, or disorder on the community, maintaining anonymity and mistrust of institutional services all play a role in areas of resistance. When looking at advocacy engagement, when working with Native American clients dealing with grief, we want to take steps that are adaptive to areas of resistance. This includes encouraging and implementing integration of services in the facility or practice to increase accessibility. When accessibility is increased, we have a higher chance of clients attending therapy more consistently. We want to connect clients with traditional healers and leaders of family programs through collaboration with care providers in the community and the state. We want to incorporate awareness of events that are not historically recognized as qualifiers of grief into group therapy sessions to increase cultural understanding and support. Looking at the counseling implications, under clinical mental health, we want to understand that community and tribal norms and values play a critical role in treatment. We want to utilize hopeful language, take a strengths-based perspective, and avoid labeling. Those last three components are important when dealing with Native American clients who are suffering from grief. Labels and negative language are barriers within their cultural beliefs and values and may increase feelings of rejection and isolation and may not validate their feelings. For school counselors, interventions should include extended family members who play a role in child rearing. Often, Native Americans do not follow a nuclear family model. This is important in consideration when helping students who are suffering from grief in social, emotional, and academic areas. Family counselors must be aware of cultural differences in hierarchy, history, and dynamics. It is also important to consider the consequences to the individual if their perspective and process of grief differs from family traditions and beliefs.
All right, so I will be covering the African American section of our presentation. So there are a number of important factors that sort of contextualize the African American grief experience. During slavery, families were torn apart and people were subjected to unimaginable loss of life, but also loss of the social and familial networks that you would lean on for support. It's believed that this is partially responsible for the importance of the extended family and kinship networks in the African American cultural experience today. Religion and spirituality also play a huge role for many African Americans and are seen as protective factors. Those who utilize religion and spirituality are shown on a number of different metrics to have more positive outcomes, and we'll see how that sort of translates to the grieving experience. Although grief over the loss of a loved one is consistent across all cultural groups, African Americans experience a much higher loss due to homicide relative to other groups, and they also must contend with shorter average lifespans. So during times of grief, practical support is often shown over emotional support or lengthy interpersonal conversations about the deceased. Often support is shown through providing food, childcare, helping with religious rituals, or just being in the presence of others during this time of grief. So as far as disenfranchised grief, it's really difficult to sort of tease out how these different kinds of disenfranchisement really affect loss for African Americans because they're so pervasive. They are facing disproportionate incarceration, racial discrimination in education and in employment, and also dealing with perceived racial discrimination, which can lead to higher negative outcomes alongside children who have parents who are incarcerated are also dealing with loss of a parent, but also loss of future opportunities or potentials due to school failure, criminal activity, or drug use. As far as desired outcomes and the steps necessary to achieve them, one of the big ones, and this is sort of a general note for counseling African Americans, but particularly when it comes to grief, there is a need to establish trust and build confidence and comfort in the mental health setting, partially due to some historical factors, including the things such as the Tuskegee experiment. There are good reasons for African Americans as a group to be skeptical or distrustful of medical or counseling professionals. So it's key to begin the therapeutic relationship with explicit, extended conversations about informed consent, confidentiality, and really building rapport and letting them know what they can expect out of the therapeutic experience. Another outcome is the feeling of acceptance of one's passing, but also the continuation of the spiritual relationship with the deceased. So this is referred to as continued bonds. And that is very common in the African American community when it comes to grief. Often when someone passes, it is not seen as the end of their life or the end of the relationship with that person. Often they will visit the graveside, speak to that person, have conversations with that person, as if their spirit is very much still with the person who is living. So incorporating those spiritual ideas or even bringing in members of the religious community as part of our treatment plan can help be more culturally responsive to the existence and the value of those continued bonds. African Americans are at increased risk of prolonged grief disorder, which is characterized by depression, anxiety, and just the extended period of time that the grief of a loss has negative effects on the individual. But very little is known about this. So both on the individual practitioner level and on the research level, we need to increase our knowledge of prolonged grief disorder, its presentations, and its treatment options, because oftentimes it's just seen as continued depression or anxiety about other factors when in fact it could be surrounding the loss itself. And also another outcome we're looking for is to connect to a larger support network, including clergy, community members, or extended family or kinship networks for those who might be more isolated and don't have that natural group around them. So we want to try to find those support networks and systems, build them and support them, but also validating the high valuation that the community puts on these extended family and kinship networks. So, whereas someone might view the passing of a neighbor as a minor loss because of the way that they view community and they support each other, oftentimes those types of losses can be more difficult for African American populations. So for the current approaches to grief, I looked at narrative therapy, group therapy, and Gestalt therapy. In general, these therapeutic approaches can work. They can have the ability to give an individual agency in their own treatment plan or to connect with others in the case of group therapy. But a lot of these modalities sort of discount the presence of continued bonds, especially Gestalt therapy. You're talking to an empty chair and trying to tell someone something and then move on, get closure, and then close that chapter in your life. But that isn't how loss and death is often conceived of, that the relationship does continue past death, and we want to honor that. We don't want to dismiss that. As far as potential areas of resistance, as I mentioned, the persisting distrust of mental health services, but also the lack of resources, including time, insurance, or transportation to regularly access these services. Also, feelings of dismissal or invalidation from community members, people saying, I don't know why you're having such a hard time with this. They were just, like I said, they were just your neighbor. But in many cases, a neighbor can be the same as, a blood relative in many cases. Individuals may also seek to keep the grieving practices separate and out of a clinical setting and keep it more in a community or a religious context. So they may not be as interested in looking at it through a clinical lens if they are already sort of dealing with those kind of issues within their own community. A final area of resistance might be skepticism from white providers or their ability to understand or appropriately respond to these culturally specific needs. As far as advocacy, there are a number of inequities that are present when it comes to grief in this way, including a lack of research on how grief impacts the African American community, in addition to very stringent restrictions both in school and work on bereavement leave being limited to immediate family, and the need to adjust workload for students who might be dealing with kinship grief in addition to family loss. This would also be important from an advocacy perspective to make sure we're not precluding or excluding continued bonds. We should be avoiding therapeutic modalities that focus only on closure or accepting the end of a relationship with the deceased, as opposed to seeing it as the possibility to continue. As far as the implications, I've sort of already touched on these a little bit, but we just need to be aware that individuals can be more impacted by loss from a wider group or range of people. So there might be increased absences or a larger impact on the African American student body as a whole from the loss of a single individual, regardless of the individual's relationship with everyone in that group. As far as family therapy, many of the things that you would want to do in family therapy, including creating a communal conversation or a grieving process, may already be occurring at home. So it may be seen as redundant, but then they may also benefit from incorporating spiritual leadership or community. In general, we need to increase our awareness of and research about prolonged grief disorder and other grief-related symptoms. And in general, we want to be avoiding cultural assumptions or expectations for one kind of grief. Because especially when it comes to prolonged or continued grief, it is just not understood and also not appreciated in the same way as someone who is in the throes of immediate loss. We also should identify individuals' access to protective factors, such as religion or their support networks, and really capitalize on those available resources.
I will be touching on the cultural effects on grief for the Latinx community. So this is a very familial and hierarchical culture or collectivist culture. There's a strong importance that is placed on family values and seeking support within the family first. A respect for authority and family structures is usually of high importance. And machismo dictates the expectation that men are not emotional and hold feelings in. Therefore, they may not seek help and may be more inclined to experience somatic symptoms. Somatic symptoms and cultural bound syndromes do occur. And as a result, physical symptoms may appear before recognizing psychological distress. This may lead to seeking medical support before mental health support. Unique values and customs, depending on country of origin and religious or spiritual influences, affect the way grief is displayed. The Latinx community is very diverse, and there are a lot of misconceptions and stereotypes about this population. One thing to understand is that the Latinx is about geography, not culture, and comprises people coming from the Caribbean, South America, and Central America. This is the largest minority group in the USA, and it's continuing to grow. Cultural conflict and levels of acculturation may cause distress within the family unit, and there are fears of deportation and family separation, which adds to grief. There is a large stigma surrounding mental health care. Many Latinx individuals see mental health needs only for people who are loco or considered crazy. Working with community religious institutions to encourage seeking mental health care and the benefits outside of psychiatric concerns can help to normalize mental health care. Another component in establishing a warm and genuine relationship or personalismo with the client. establishing trust and confidentiality or confianza. Just because an individual seeks mental health care, it doesn't mean their family or friends will understand it or accept it. Reducing grief symptoms is another outcome. Machismo may prevent men from seeking support. So allowing space during individual therapy for processing of emotions without jeopardizing their reputation within the family hierarchy may be important. Working to connect individuals with larger support network, religious institutions, and local community resources if their family support system is low is important. And then working to apply evidence-based therapy is important. However, this can prove difficult because there is limited research. Considerations for acculturation to assist in cultural harmony. Clients may feel concerns over cultural versus societal expectations. Understanding how the client fits into their family system and working with them to understand their role may be beneficial. Also considering how ritual, prayer, and healing methods are used, and if they can be applied in the counseling setting, and being considerate of spirituality and how the client approaches death and loss. Current approaches to grief have not been extensively studied with regards to the Latinx community. As a result, there is limited knowledge, and studies surrounding how to apply theories and techniques is limited. Most indicate that the foundation for therapy approaches is going to be cultural understanding and of religion, spirituality, and family hierarchy, and establishing a solid and warm and genuine relationship. Currently, cognitive behavioral therapy is most used for the Latinx communities, but it has to be amended for the cultural context. And finding what that is does prove to be difficult, as there again is not much research. Family therapy is also frequently used as the family structure is very important, and this can provide assistance in establishing family conversations and overcoming grief. However, the family support system can also be detrimental when family members do not align with the beliefs, and this can create discord during family therapy sessions. Narrative therapy is an emerging and potential approach, but currently it's inconclusive. Some ideas surrounding narrative therapy are storytelling, understanding cultural expectations, and one interesting approach would be maybe building an altar in discussing death and loss of loved ones. This might help an individual work through feelings and process emotions, especially if they have limited family support system. Potential resistance in this community is going to have a lot of considerations for the acculturation. Their societal versus their cultural values. And individuals who have bicultural values are more likely to accept mental health counseling. And if there's an inability to establish a warm and genuine relationship, this may lead to the Latinx community not returning for therapy. Acknowledging the need for mental health support or the stigma surrounding mental health care is an issue. There are cultural bound syndromes, so individuals may feel like there's nothing wrong or they do not need assistance. And if they do, they're more than likely to seek medical care for physical symptoms and deny their psychological distress. There's also limited access to care, which is a huge hindrance for the Latinx community. There is a significant lack of insurance, there are language barriers, and there is a significant fear of deportation for undocumented individuals. Some advocacy or ways to engage the Latinx community would be to decrease language barriers by providing interpreters and encouraging members of the community to pursue mental health care. Engaging religious institutions to encourage mental health care services and assist with awareness campaigns about the benefits of mental health care. And increasing the research for evidence-based therapy approaches that are culturally appropriate. The limited data and research surrounding effectiveness of current treatment approaches hinders appropriate advocacy. Currently, of course, the Latinx community is the largest ethnic minority in the USA, but they have the least amount of research in regards to therapy approaches. Some counseling implications. Family being such a strong system, they may not understand why an individual is seeking mental health care. Acculturation levels within the family also can create potential tension. The hierarchy in family structures with older generations disapproving of younger generations or American values. In the clinical setting, counseling and information provided in appropriate language is important. Not developing a mutual relationship may hinder further therapy sessions and potentially misdiagnosing psychosis by not understanding culturally acceptable behaviors. It is not uncommon for individuals to see spirits or speak with deceased loved ones. In the school, language barriers are a concern. So school forms should be translated, interpreters should be provided in order to assist in school barriers. And of course, assuming acculturation, not allowing for culturally appropriate behaviors surrounding grief and death may erode trust and lead to isolation for students.
Okay, so I have the cultural effects of grief with the Asian American community. So Asian Americans typically have a collectivist culture. Grief and loss in the Asian American population are deeply influenced by Confucianism, Buddhism, and Taoism. And so with Confucianism, the belief is that one's virtue and accomplishments are more than a lifespan, and death and loss can actually be celebrated long after somebody passes. While Buddhism and Taoism, those religions believe in spirits and reincarnation. Migratory grief can be caused by leaving loved ones behind, leaving cultural norms, and as well as belongings behind. So this type of grief falls under the umbrella of disenfranchised grief. Some desired outcomes. So one of them, it would be to lower stigma as a counselor. And the way to do that would be to provide education and empowerment around grief and loss while providing a space that allows for both Western and Eastern medicine practices to be used. The next would be to support and empower a client. And to do this, the counselor could help the client by finding balance if they do not wish to directly express their grief and loss. And also a way to do that would be to recognize that each client's cultural journey is unique and that their way that they express and experience grief and loss is also unique to them. Lastly, providing access to Indigenous healing as a way to cope and heal would also be beneficial and would help to provide the client with multicultural care. 3 current approaches that I chose to talk about were cognitive behavioral therapy, mindfulness-based cognitive therapy, or DBT, and family therapy. So the 3 current approaches for the Asian community that would best suit them, as I stated, are CBT, DBT, and family therapy. Because of the theoretical roots in Asian philosophies, mindfulness and acceptance-based psychotherapies can greatly benefit Asian Americans. With mindfulness-based cognitive therapies, the counselor would help the client acknowledge negative events without attempting to change them. Some potential resistance that Asian Americans could face might be the lack of confidence in a counselor if they do not understand the Asian community. A client may also have reservations about expressing grief symptoms externally to strangers, as this is not typically customary in Asian culture. So if a client comes in, a counselor should recognize that it might take a little bit of time to kind of get that rapport grounded before somebody of the Asian American population might start to disclose personal problems that they're having. Asian Americans might also withhold problems they faced in order to keep harmony between their friends and family, as this culture is highly experienced in the collectivist culture. They value family, they value their friendships and their relationships, and all of those relationships are their idea and their identity as a sense of self. So it's difficult for them to go and cut those cords as easily as somebody in the Western civilization would do. Cultural priority on close relationships informs one's sense of self, according to a study by Marcus and Kitsuyama in 1991. If this were to be true for a client, this could influence the collectivist versus independent mindset of the client and their overall desired outcomes for seeking therapy. And for some advocacy, a way to advocate for this population would be to promote further research specific to Asian culture in relation to grief and loss. Not a lot of recent studies have been published or researched in depth, which hinders the inclusivity of this population in mental health care. Secondly, counselors should ensure a client within this population has access to an interpreter, Indigenous healers, and also ensuring that the counselor has flexibility with the clients while they are seeking counseling sessions. Lastly, making culturally adaptive approaches easily acceptable to Asian American clients can help promote awareness and education while also decreasing the stigma surrounded by mental health care. So for some counseling implications, so for family, being aware of the intergenerational conflict between grief coping strategies, such as the younger generation using the host country values to cope with grief versus their first generation ancestors using Asian culture to cope with grief. The counselor should be aware of that and understand, like I mentioned earlier, where that client is in their grieving process and how their culture influences their coping and grieving processes. For clinical mental health, the counselor needs to understand the Asian culture-bound syndromes. For example, the loss of a family member isn't just personal, it is actually a loss of a familial role. So instead of just losing the person, you might be losing the head of the household on top of losing a grandfather or a father. For school, it's best to understand that the socioeconomic status and barriers to this population and how this may impact the counseling experience and accessibility to counseling. And for the client, it is also good to be aware of the countertransference that could occur during counseling sessions and to recognize that Western notions of grieving may not be synchronous with the Asian cultural grieving process. And this concludes our presentation. We appreciate you taking the time to watch. Thank you.